Hi, my name is Dr. Troy Stuckey and I want to welcome you to our thyroid recovery program. I've been a chiropractor in St. Paul, Minnesota for over 12 years and I specialize in neurometabolic care. So what I want to talk to you today is basically how we get thyroid disease sufferers better and how we are probably unlike any doctor that you've ever been to before. What makes us different is that we treat you neurologically and metabolically to fix your problem. So first off, let's talk about what the different thyroid conditions are in depth. If you have hypothyroidism, you probably are chronically tired, you have fatigue or you're sluggish, you don't feel like doing a whole lot. You may have cold feet and or hands. You require excessive amounts of sleep to have a normal day the next day. You may be gaining weight, or you may find it difficult to lose weight even with proper eating and exercise. You may have infrequent or difficult bowel movements. You may feel constipated. You may suffer from depression, lack of motivation to really do things or perform jobs around the house. You may suffer from morning headaches that wear off as the day progresses. You may have thinning hair or excessive hair that falls out. You could suffer from dryness of the skin and or scalp, and then mental sluggishness may be a problem. Now if you have hyperthyroidism, this is the condition where your metabolism speeds up, so it goes into overdrive. You may suffer from heart palpitations or irregular heartbeats. You may have inward trembling. You could have increased pulse even when you're resting. You may feel nervous, emotional, or irritable. You may have insomnia, trouble sleeping, or night sweats where you sweat at night. And then you may have difficulty gaining weight even if you eat a lot or eat the right foods. If you have an autoimmune disease, that's called Hashimoto's thyroiditis. It's the most common cause for a hypothyroid, and with Hashimoto's you may have signs of hypothyroidism and hyperthyroidism at the same time, and those can flip-flop back and forth. So the job of the thyroid is basically to run our metabolism. It either steps on the gas or it puts on the brakes. Thyroid hormones have direct effects on most of your organs. It includes the heart, which makes it beat faster and harder under the influence of increased hormone. And that is why someone with a thyroid problem a lot of times is going to have a heart problem at the same time. T3 is the active hormone that the thyroid produces. Your body only produces about 7% of T3. The other hormone that's produced is T4, and that hormone is only 83% produced. One of the problems with some thyroid disorders is that you may have trouble converting T4 to T3, so we call that underconversion. To know that, what you have to do is you have to have the proper test performed. A lot of people who have thyroid conditions have only had TSH performed, and then what happens is you get a medication. You might have thyroid hormone, and you take the thyroid hormone, but you still have the symptoms. Nothing ever changes. So you have to run all the tests to find out what's wrong. Now a doctor that I highly recommend is Dr. Datis Karazian. He wrote a book, Why Do I Still Have Thyroid Symptoms When My Lab Tests Are Normal? I would highly recommend that you get a copy of that book. But what Dr. Datis says is one of the worst things that you can do is take iodine supplement. I know taking iodine is a very popular thing to take if you have a thyroid problem. But what that does is when you take iodine, you actually throw fuel on the fire and you make your condition worse. Most thyroid conditions, like I said, are autoimmune, so if you take iodine, it's basically like you're making that condition worse and worse and worse. What I want to tell you is that with our program and how we address these problems, there's new hope for you to get this condition taken care of and get healthy again. we basically leave no stone unturned when we're trying to find out what's gone wrong with the thyroid. What I want to talk about now is I'm going to address, one, what makes our program unique, and two, how I successfully will treat the thyroid problem. So we treat these conditions in two parts. We treat them metabolically and neurologically. Metabolically is fixing all of the processes that are going on inside in your body. Neurologically is making sure that the nervous system is healthy and doing what it's supposed to do. So on the metabolic side, what we do is we run laboratory tests. And the first test that we run is called a food sensitivity test. Now, we already said if you have a thyroid problem, you probably, most of the time, it's an autoimmune condition. The sensitivity test is used to find out if there's something that you're eating that your body is allergic to. The most common food sensitivities are going to be gluten, dairy, eggs, yeast, and soy. Those are the big five. If you're allergic to those foods and you don't know it and you're eating those foods, what it's actually doing is it's making your condition worse. So you got to run the test. Here are some symptoms if you are sensitive to a food. So if you experience any of these symptoms, you probably have a food allergy and you don't even know it. Number one is chronic pain or fatigue. Fibromyalgia just comes to mind. With fibromyalgia, most fibromyalgia patients have a food sensitivity. Frequent indigestion. You may have stomach pain, gas, bloating. You may have loose bowel movements or again, constipation. You may have a propensity to develop ulcers or sores in your mouth. And you can also suffer from vomiting more frequently than a normal person would. Again, the only way to find out if you are sensitive to one of these foods is to run the appropriate test. Now the next thing that we do is we do a complete blood panel. Not a basic blood panel, but a complete panel, which is pretty extensive. We want to find out everything that's gone wrong, so we do the blood panel. What we're going to check is a complete metabolic panel, or a CMP. We're going to check your lipids, which has to do with your fats and cholesterol. We're going to do a complete blood chemistry with auto differential. So all of this constitute the complete blood profile. Now a lot of patients come in and they tell me, well, all my blood tests were normal. First off, you probably haven't had all the blood tests run. Most of the time, if you go in for blood work, you're only getting basic blood work. It could be 10, 12, maybe 15 markers, when in actuality there's 30 or 40. Typically when we get a blood test back that we submit, it's about 5 pages of information. On top of that, when you go to the lab, what happens is that the laboratory ranges are very broad. Everybody who's going into the lab is generally sick. So most doctors go by those laboratory ranges. Problem is, healthy people don't have the same ranges. If you're healthy, your number should fall into what's called a functional range. As an example, a proper number for TSH is 0.5 to about 5. That's too, I misspoke there. That's too wide of a range. Where the number should be is from about 1 to 3.5. So we want you in the functional range, or the healthy range. We don't want you out here in the sick range. So we look at functional blood values. Along with the blood work, we also look at your thyroid markers or your thyroid tests. Not just TSH, not just T3, but there's upwards of 10 markers that we look for. Thyroid stimulating hormone, or TSH, this is the message sent from the gland in the brain, the pituitary, to the thyroid that tells it to start producing the hormone. We check free T3. We said T3 is the active form of the hormone. It's an important hormone produced by the thyroid gland, and it's considered to be the more biologically active form of the hormone. We check free T4. T4 is another important hormone produced by the thyroid gland, and T4 has to be converted to T3. we check your thyroid binding globulin, or TBG. This test measures the amount of proteins in the blood that transport the thyroid hormones to the cells. Elevated testosterone can lower TBG levels, and elevated estrogen can raise TBG levels. Both situations can produce hypothyroid symptoms. Now, we said most of the time if you have a thyroid condition, you're actually suffering from an autoimmune attack. And what's happened is your immune system is attacking the thyroid gland, and it's gradually eating it away and destroying it little by little by little. And it's made worse by if you have a food allergy, because whenever you eat that food, it's making the thyroid get killed little by little by little. So we run what's called a thyroid antibodies test, TGB and TPO. Some of you may have had that test run, but it is not the only autoimmune test that's out there. There are immune panels, which I'll show you just in a moment, which are just as important, and those have to be ran. We test you for total T4. This is a test that shows how much total T4 is in your bloodstream. Free thyroxine index, it's an estimate of how much thyroxine is in the blood. And resin T3 uptake. This test measures the amount of active receptor sites that are available for T3 to be taken. So we run those complete thyroid tests. Again, not just TSH, not just T3. You have to have a complete picture on what the thyroid's doing to know how to treat it. We run a test called an adrenal stress index. Now, your adrenals are organs that sit right on the top of your kidneys, and those organs are designed to deal with your body's, the amount of stress that you're under. The adrenal glands have to be healthy because they work side by side with the thyroid gland to manage your stress and either put the brakes on or speed up your metabolism when it needs to be sped up. So the adrenal stress test is very important to find out what is the health of the adrenals. Now, your immune panels, these are extremely important. More than likely you have an autoimmune condition, but to find out we need to run the immune panels. Now, there's two parts to your immune panel. There's what's called a Th1 side and a Th2 side. And both of those sides of the immune system have to be working together. So the immune panels that we run are interleukin-2 and TNF-alpha. They're also called the T cells, or the army, or the attacker cells. They're the cells that go and kill any invaders, germs, bacteria that are in the body. Interleukin-4 and interleukin-10 make up Th2, and those are what's called the regulator cells, or the B helper cells. They're the ones that recognize who those invaders are. So the next time that they come around, your body is able to go and fight and mount an attack faster. Let's say your interleukin-2 numbers are high. What that would mean is you were Th1 dominant. So if you're Th1 dominant, we have a protocol to help get that Th1 to chill out and be more balanced. Also, with the immune panel, you want to determine if there's what's called an active antigen, which means there's something that your body is allergic to or doesn't like that your immune system is not able to kill. Or you have to figure out if your immune system is what's called dysregulated, meaning it's not being balanced properly. How we determine what is going on there is with a test called a helper-suppressor ratio, which is on the TMB cell panel. This ratio is called the CD4-CD8 ratio. Now, the normal ratio should be 1.2 to about 2.5. If the ratio is higher than 2.5, that means that you're most likely dealing with an active antigen. Something is in your body that your immune system either can't kill, or you keep putting that substance in over and over and you're allergic to it. If this helper suppressor ratio is below 1.2, then you most likely are dealing with a dysregulation problem. And what that means is that the Th1 and the Th2 sides of your immune system aren't working in balance, or one side is way more dominant than the other. We have, like I said, we have a protocol to get that leveled out and get that balanced. We also run a test that checks your digestive function. A lot of times I have patients come in and what we find is that their gut or their digestive system is not healthy. They may have a harmful bacteria, they may have a virus, they may have a parasite, a mold, or a yeast. Something in their gut is causing them to be unhealthy. Up to 80% of your immune system is in your digestive tract. So if your digestive tract is not functioning properly, you're going to develop autoimmune problems and potentially thyroid problems. So we do what's called a stool microbial panel or profile. That's going to let us know what the health of your digestive system it looks like. So metabolically, we run the tests, we find out what's wrong, and then we either clean up your nutrition or diet, or suggest some type of supplement that you may need to help get what's inside working properly again. Now the other side of the fence is we aim to fix you neurologically. Your nervous system is the master system. It involves your brain, your spinal cord, and your peripheral nerves, and then all the nerves that go to your cells, tissues, and organs. And your nervous system has to work at 100% peak performance for you to be healthy. So what we do is we do specific neurological testing. We take you through a neurological exam to find out if anywhere in the neurological system is broken down. And if it has, we have treatment methods and protocols to get that working right. One common thing that we do is what's called oxygen therapy. Oxygen is fuel for the brain and nervous system. Your body needs, your nervous system needs two things to be healthy. It needs fuel and activation. Now normally you get fuel from the oxygen and the glucose from the food that you eat. But as we get older, our body's ability to take oxygen from the air gets decreased and diminishes. It's exacerbated and made even worse if you're a smoker. So we need to find out if you need oxygen, and if you do need oxygen, we show you how to get oxygen. We'll put patients on what's called an upper body ergometer. It looks like basically a bicycle that they pedal with their arms, and while they're pedaling we give them oxygen through the nose using what's called an oxygen concentrator. We use what's called brain-based therapy. Now when we take you through these neurological tests, we may find that different areas of your brain are deficient or not working right. You may have poor balance, dizziness, vertigo, trouble concentrating, trouble reading or interpreting spoken words. Those are all signs of brain deficiencies or problems with the brain. We call that decreased frequency of firing. So we use what's called brain-based therapy, which is designed to help get your brain basically working better and functioning so everything neurologically is at a higher level. Your cerebellum, which is the back part of your brain, basically controls all the postural muscles of your spine and your coordinated and balanced movement. A lot of times what we see is problems with your cerebellum or decreased brain function due to problems with the cerebellum. A way that you can test this at home is what you do is you stand with both feet together and your arms at your sides, and then you're going to stand with your eyes closed. Now if you feel very wobbly or spinning or you have dizziness, that's a sign that your cerebellum is probably not working right. If you want to take it one step further, what you can do is close your eyes, bring your arms up straight in front of you, make a fist except for your little fingers. Then with your eyes closed, what you're going to do is take your little fingers and come in and you're going to touch the tip of your nose. And you're going to alternate back and forth. If you have a cerebellum problem, what you may find is that you might poke the side of your nose or hit your cheek or hit your chin, or when you come in you start to shake or you don't come in real confident. that's a sign that you have a cerebellum problem, and that is a part of the brain that we work on because the cerebellum controls all your balance and posture. So again, just to reiterate, when we work on the thyroid, we work on you neurologically and metabolically to get you better. If you just do neurological care, you're probably not going to get the results that you want. If you just do metabolic care, you're probably not going to get the results that you want. But when you combine them together and you do both parts of the puzzle, you get excellent results and we can get you healthy again. Now I want you to just take a moment and ask yourself, how has your thyroid condition affected your relationships, your finances, your family, or your other activities? What has it cost you in time, money, happiness, and sleep? Where do you picture yourself in the next 1 to 5 years if this problem is not taken care of soon? Seriously, think about that. We've only got a certain number of years on this planet. You want to enjoy every day and you don't want to be sick. I'm here to tell you that we have a program that can fix your thyroid condition, but you have to understand that you've got a problem that's probably not going to go away just by taking a thyroid hormone or taking drugs. Number 4, what is your condition worth to you if we could improve your condition? I am totally serious that I do not accept patients that I do not think that I can help. What that means is if you're not willing to make changes to get your health back, for instance, if you're allergic to gluten and you're not willing to stop eating gluten, then I don't want you to waste my time or your time. We only want people to do our program who are serious about getting their health back. So if you're ready to get healthy, then it's time for you to come see us. What we're offering is 2 free visits to see if we can help you. What that's going to involve is you're going to come in for a neurological exam. I want you to bring any thyroid blood work or laboratory work that you've had done. Bring that in so that we can review that for you. And then on the second visit when you come back, we're going to let you know whether we think that we can help you or not. So again, it's for 2 free visits. What you do is you're going to call our office. The number is 651-779-8883. Again, 651-779-8883. Let them know that you saw Dr. Stuckey's Thyroid Recovery Program. You want to come in for the 2 free visits, and we'll go ahead and we'll get you started. Thank you.